Hi, everyone. Welcome back to another episode of Therapy Cafe, the future of mental health. This is episode 3, the whole child approach to treating autism, with our guest, Dr. Suzanne Goh. Today, we'll be talking about working with children of autism. There are only a few evidence-based mental health treatments for patients with autism, and today we will be diving into a promising perspective, the whole child approach. A whole child approach to autism means investigating and treating all of the factors that are important for a child's lifelong health and development. This might sound daunting, but I truly believe every parent and every clinician can do this for a child. All you need is the right knowledge and a roadmap to guide you. The whole child approach was developed by Dr. Suzanne Goh, and lucky for us, she's our guest today. Dr. Suzanne Goh is a pediatric neurologist, board-certified behavior analyst, and neuroscience researcher. She is the founder and chief medical officer of Cortica, a health services organization with medical and behavioral health centers across the country that provide a comprehensive whole child approach to autism care. Dr. Goh is a graduate of Harvard Medical School. She attended Oxford University as a Rhodes Scholar, and she completed her neurology residency training at the University of California, San Francisco. She has served on the faculty of Columbia University, where she was co-director of Columbia's Developmental Neuropsychiatry Clinic for Autism. Her research has focused on the biological causes of autism and the use of brain imaging to identify patterns of neural circuitry and brain chemistry in autism. Dr. Goh published a book in April that leverages her renowned and revolutionary model of care that we're going to talk about today. The book is called Magnificent Minds, the New Whole Child Approach to Autism. Remember, at the end of the podcast, we'll provide information about how you can obtain continuing education for this course. Also, ensure you never miss an episode by hitting the subscribe button. Here's to our conversation with Dr. Goh. Tell us, what inspired you to specialize in this area?
Well, thank you, Marjorie. I'm so happy to be here today and to have this conversation with you. For me, I had a really important experience growing up. So I grew up in Toledo, Ohio, and when I was in high school, I had the opportunity to volunteer at a summer camp for children with neurodevelopmental differences, including autism, but others too, like intellectual disability, cerebral palsy, a full range of different neurological conditions. And I was camp counselor. And one of the beautiful things about this camp was that they paired a neurotypical high school student counselor with a neurodivergent camp counselor.
Oh, wow.
And my co-counselor had cerebral palsy. And that was really my first experience getting to know a neurodivergent peer and seeing his intelligence, his humor, and getting to know him over the course of that summer. And getting to know all the children at the camp, I think, was when I first, my passion and my interest in neurodevelopment really came to be. And so that was a very formative experience for me, and then kind of led me down the path of pediatric neurology, and of course, more recently, getting my certification as a behavior analyst too.
Wow.
So it's been a great learning journey for me, and it's been very rewarding.
Wow. I guess, could you help us? I guess my basic next question would be, can you help us understand the definition of autism?
Yes. Well, when I talk about autism and how it's defined today, I like to start off by saying definitions and how we understand autism has changed so much over time.
Oh, wow.
You know, it was really back in the 1940s, so about 80 years ago, that autism first was described and recognized and appeared in the medical research literature. And then we went through many, many decades of just not knowing, very little was known about autism. And there were all kinds of theories, some of them harmful. There was a theory that actually blamed parents for autism. The term refrigerator mother was used to really place the blame on mothers. So you can just imagine the tremendous harm and trauma and damage that caused. I feel it's very important for us as healthcare professionals to remember that, because we have to make sure we don't make those same mistakes now. But we're fortunate in that in just the past few decades, research has really, really advanced. So our understanding of autism is now so much deeper than it used to be. And we now think of autism as a constellation of characteristics. So it's important to remember a diagnosis of autism is not a biological diagnosis. It is a descriptor of a set of characteristics. And there are two main categories of those characteristics. One relates to differences in how a person interacts socially and communicates. And then the other big set of autism features relate to what the DSM, the Diagnostic and Statistical Manual of Mental Disorders, refers to as repetitive or restricted behaviors and interests. So it's kind of those two main kind of sets of features that now are considered the defining and core features of autism.
And then can you help us understand the spectrum? And is there a point on the spectrum where it says, this is mild enough, it doesn't constitute, or this is more severe, or how does the spectrum work?
Yes. So the word spectrum and autism spectrum is such an important part of understanding autism, because it can look so many different ways. And I think that's part of what has made it hard for professionals and also caregivers and the public to kind of wrap their minds. And really, autism, I think, can feel like a little bit of a mystery because it can look so many different ways. And it's so one of the things that that I think is helpful is to think about age. So autism will look differently depending on a person's age. So in young children, it can show up as maybe a delay in developing spoken language. So speech delay can show up as reduced social interaction. So young children, even in the first year or two of life, might show as one of their early signs, reduced eye contact. They might look at their parents less. They might show sort of less engagement with other people. And then now we're recognizing even early on, there are some symptoms or features that are more related to the sensory system. So some children are almost hypersensitive to the world around them. And so they can become more irritable and upset by certain stimulation around them. And others seem hyposensitive. So they're sometimes described as easy babies. They just seem content to be kind of left on their own. So autism can look a lot of different ways, but most often, especially for young children, it appears as less social interaction and reduced communication, often in the form of speech delay.
It's fascinating. And then you've spent all these years studying it, and then you've developed the whole child approach. What was the impetus of that? Did you feel like the treatments out there weren't really sufficient enough or could have been improved upon? I mean, how does one go from saying, I'm going to develop my own treatment?
Well, it took, for me, it was a path of learning. I had, wonderful teachers and mentors. I went through medical school, had a very strong interest in pediatric neurology, and knew quite early on I wanted to focus on autism, and learned from psychologists and neurologists and psychiatrists and behavior analysts and occupational therapists. And so it was very much kind of my journey of seeking and really wanting to soak in and learn as much as I possibly could. And over that course of time, and some of that was at Columbia University, where I was able to be part of their wonderful interdisciplinary autism program, and then eventually direct that program. It was really seeing that all of these components of care were so important, and that our current healthcare system was one in which the services were highly fragmented. So families had to go to different providers and different places for every piece of their child's care. It was overwhelming. It was confusing. It made it very hard for them to carry through, even though they put in tremendous amounts of effort. and really wanted to do the best for their children. The way our healthcare system was set up did not allow for that. And so I felt very strongly that we needed to create something. We needed to create these holistic whole child centers where all of the professionals came together and collaborated and integrated to make it a much easier path for families.
Which I would say that just that makes so much sense. So it seems like part of the whole child approach is demystifying the range of treatment, diagnostics, and then the influencing factors that play a role in successful outcomes. So I would imagine it's because it's the whole thing is complex or confusing. So could we start with the current landscape? Like when you say you bring them all together to the whole child approach, what are the available types of care?
Yes. So because autism at its core is a neurodevelopmental difference or neurodevelopmental condition, it means it affects how the brain develops. And not only is the brain developing in different ways, the brain is also influenced by the rest of the body. So the health of the gastrointestinal system and metabolism and the immune system and many other body systems influence brain development. And we also know that a child's interactions with the family, with in the home, in the school, in the community, also influences brain development. So brain development is a very intricate and complex process that can be influenced in so many different ways. That means that part of autism, part of wanting to shape a child's brain development will require many different kinds of support and therapy. And so what families face now is the need for medical care. And in the area of just medical care, it could be working with a neurologist, a gastroenterologist, their primary care pediatrician, a number of different specialists.
Wow.
So there's that piece. Then there's developmental care, where a child might need support from an occupational therapist for their sensory processing and motor development, from a speech language therapist for communication, from a behavior therapist for a behavioral type of intervention. And then they may also need sort of more family support, like care coordination or mental health support. And they're also interfacing with clinics, with school systems, often with government agencies for various early intervention services. And so it becomes this very kind of disjointed, complicated landscape. And often the parent ends up being quarterback, having to translate and deliver messages between all the professionals. And it just gets in the way of what I view as optimal holistic care for the child.
That makes so much sense. And there's so many pieces to it. It almost seems like it's a puzzle and the child is the whole and all these different pieces. So how would you define whole child approach to care? Like what would be your definition of it?
Yes. So I think of a whole child approach to care. I actually represent this approach there's a diagram that's in the book and also that we use at our Cortica centers of a tree. So we think of child development as a tree, and it represents a whole child approach means seeing the entire tree. And the roots of the tree are the child's experiences and their relationships at home, in the school, in the community. Those provide the strong roots and the foundation for child development. And then the next part of the whole child approach is the trunk of the tree, which represents the health of brain and body. Things like understanding a child's genetics, their neurophysiology, neurochemistry, the health of their GI system, immune system, metabolism, even things like nutrition, exercise, stress reduction. All of those are important for brain and body health. And then the branches of the tree, we then can move on to think about the development of brain networks. And I really emphasize it's important to think of all the domains of brain development. So sensory, motor, cognitive, language, social, and emotional. And then the next element of a whole child approach is thinking even bigger about lifelong physical and mental health for the child, and really focusing on things like self-care skills, relationships. We think about how to give the child a sense of purpose and meaning. So I strongly believe every child, every person has a contribution to make. And so it's just about support and creating those opportunities. And then at the very, very top, so the really the ultimate goal of a whole child approach is to create experiences of joy. And so I think of joy sort of like the rays of the sun, the way that nurtures the growth of the entire tree. And it's also the purpose of everything we do is to unlock more experiences of joy for our clients and their families.
I love that analogy. That just like gave me the chills, and it was much better than my puzzle one. But I love the way that you just, that you really like look at the whole thing from the roots to the sun to the branches, and I think that is a beautiful way to look at it, and that it grows and nourishes over time, and that joy is the ultimate sort of goal with that, which is such a beautiful way to have as your sort of North Star, if you will, because there's so much anguish, I would imagine, that goes through all of these things. Um,
Yes.
how would you describe how this model, I mean, it seems very obvious to me, but how does it benefit the children?
Yes. So I think the benefits are really broad. So first, of course, um, benefits to developmental outcomes. So helping a child to progress more rapidly in all the different domains of development. I would say second, benefits to mental health, because we know that if you're only offering kind of one small piece of a holistic care approach, you're more likely, unfortunately, to not see um, the extent of progress that you could otherwise, and also potentially more likely to cause harm. And that has happened a lot. So I talk with families all the time who describe to me periods in which their child may not have been getting any therapy services, but was simply on medication. I often see children who come to me on 3 or 4 or even 5 different medications with
Wow.
lots of different side effects and not getting developmental services or behavioral therapy. So um, there's just the benefits really of a whole child approach relate to better developmental outcomes, improved mental health, better quality of life for the child and for the whole family.
So we spend a lot of time talking about evidence-based practice and, really trying to elevate it because, so many times with therapists and myself included, we go to school decades later, we're still practicing and things change. And thanks to people like you, we have new interventions that develop and we don't really learn them. I mean, we don't even really learn them in school, let alone that we're out of school. And so it's more challenging for us as therapists to kind of know the latest, greatest, and what does evidence based really mean or evidence informed. So I'd love to hear a little bit about the principles or research. I'd love to hear a little bit about the principles or research that supports this whole child approach.
Yes. So I think some of the most exciting research developments in autism have been in the area of treatment therapy. Certainly, improvements have been made in diagnostics too that are very important, and they're linked. But I think of the advances in research as falling into a set number of categories. One is I think of as lifestyle changes. So things related to, especially to nutrition and exercise. Exercise, interestingly, is so research on exercise and autism has shown that exercise is the one intervention that improves the most, the kind of broadest range of different symptoms in autism. So, for example, research has shown it improves executive function, it improves socialization, improves language acquisition and communication.
Wow.
It improves overall quality of life. It improves emotion regulation. There's no other single intervention for autism that can improve all those things. So, in my mind, exercise and nutrition, so we know that nutrition is extremely important. Um, those are very, very important and now considered an evidence based approach for autism. The second main category relates to sort of medical interventions. So certainly medications, and there are a wide range of different medications that now have a lot of research to support their use for autism, but not just for autism's core features. So there are some medications that target what we think of as irritability for autism. Yes, there may be a role for those like aripiprazole and risperidone. Those are the two probably the most commonly used. But there are a lot of other medications that can help with the co-occurring features or co-occurring diagnoses with autism. And some of those co-occurring diagnoses are medical, so things like seizures, sleep disturbance, GI symptoms and disorders. There are also mental health co-occurring conditions like ADHD, OCD, anxiety, depression. And so appropriate treatments for those can have a profound benefit as well. There's also growing research for a third category of therapies that we refer to as device therapies or neuromodulation. Now, these are really exciting, and they use, they're kind of two different types. One type uses either electrical or magnetic stimulation to modulate the nervous system. There's one in particular that we use a lot that helps to stimulate a nerve in the body called the vagus nerve using a tiny electrical impulse. And the vagus nerve is the major nerve in the body that helps to stimulate the parasympathetic nervous system that helps put our body in a state of rest and digest. So it really helps reduce the body's stress response. And we know in autism, there often is chronic heightened stress response. So this category of device and neuromodulation therapies is really exciting. There's also some software. So there is an FDA approved software that helps with symptoms of inattention, hyperactivity, impulsivity, and which we know are very common features of autism. And that particular software is very much like playing a video game. It's called
Oh, wow.
Endeavor RX. And so this is a really exciting evidence-based area of growth as well. And then I'll just mention kind of the last category, which in some ways is the biggest, is what I call developmental and behavioral approaches. So things like applied behavior analysis, ABA, also called behavior therapy, has a lot of research to support it. And what's exciting about ABA is that the field is really moving in a direction where they're finding opportunities within a child's natural routines. So they're utilizing a more naturalistic approach. They're also really emphasizing supporting a child through therapy sessions where there are very strong relationships. There's a sense of safety, trust. It hasn't always been that way, unfortunately, but this is a really important direction. And all of this has a lot of strong research support to show that it really helps with long-term developmental outcomes.
Thank you for going into that detail because it makes so much sense when you explain it that way, and it just seems so like that's the way the care should be. Is it similar to other approaches? Are there other approaches out there?
Yes, this idea of a holistic whole person approach has really taken off in medicine, and you'll find it in a lot of other areas. So, for example, cardiac health, in adults, even in oncology or cancer care, there are centers of excellence that kind of bring all of the components together and provide patients with a really clear path that's holistic and comprehensive. It just hasn't made its way until now into autism or into neurodevelopment care. But I think in so many ways, autism and other neurodevelopmental conditions are where we need it the most.
Are there any pitfalls to this approach that one would have to try to mitigate?
Yes, I think the biggest pitfall and potential risk is that families can become overwhelmed, because to know that there are so many potential co-occurring conditions that might come with autism, and to know that there are so many potential therapies or treatments that could be helpful can be overwhelming. And I think that's where a professional collaboration with professionals that you trust is so important to provide guidance. You don't have to do it all at once.
So we're going to now kind of pivot to therapists and what therapists can do, and then we'll talk a little bit more about family and caregivers. So when we think about therapists, are there any specific things for people that begin working with children of autism? Are there some things that we should know about how to get started, to be effective with them?
Well, I think mental health support for neurodivergent individuals is so important, in part because the rates are rising, and also because we know, especially for autism, that co-occurring anxiety, depression, OCD, ADHD are very common. So there's such a need for mental health support. And not to mention for the families, of course, as well. Um, I think understanding some of the autistic core features is really important when thinking about how a mental health professional can support that person in therapy. And one of the biggest things to recognize is that autism actually can look quite different in males and females. And gender identity is often influenced, so that gender identity seems to be a little more fluid in autistic individuals.
Wow.
So having that background knowledge is important. And then recognizing that there are some differences in how autistic people may communicate. So there can be more of a tendency to interpret language in literal ways and a little bit more difficulty understanding non-literal language, like metaphors or like sarcasm or potentially more abstract language. I think that understanding those differences in autistic communication, I think, can be helpful for therapists to know.
So, what we talk a lot about strengths, right? Like how we can focus on strengths. And I imagine that that is equally as important when we're talking about kids who are, should I be using the word autistic or should I say neurodivergent or what? I guess let
Oh,
me ask that question. So I keep using the word autistic or autism. Should I be using neurodivergent? What's actually the correct term in today's world?
thank you so much for asking, because I think so many people are curious and want to be using appropriate, respectful language, but things are changing very quickly. So it's not always possible to know. So uh, there are these wonderful autism self-advocacy organizations that have provided guidance to us as healthcare professionals. And so what they are asking for is that we use what's called identity first language. So wanting to view autism as a valued part of one's identity rather than a disorder that somebody has. And so increasingly the use of language like autistic person, autistic individual, autistic child is encouraged. And the word neurodivergent refers to not only autistic individuals, but is much broader than that. So neurodivergent can be used also to include ADHD, OCD, anxiety. So neurodivergent is a much broader term.
Okay. Thank you for clarifying that for me because I want to make sure that, I'm also using respectful terms. So when we think, and that makes a lot of sense to me, when we think about working with an autistic child, and we always talk so much about strength-based treatment and strength-based approaches. How does that tie in for both clinicians and caregivers?
Yes. So a strengths-based approach is, in my view, essential. Um, no matter what type of therapy you're delivering, you really should be coming at it through a strengths-based lens. So I like to define a strength as something someone can do, and when they do it, it serves them well. And I also think it's really important that we don't define strengths in comparison to other people. A strength should really be viewed in a unique way for that individual. And I think it's important, especially as we're really trying to support autistic individuals, that we recognize strengths truly do outweigh weaknesses. And that's a message I think feel very strongly we should be delivering to autistic children from the very beginning. And it's not a message historically that has been delivered, by healthcare professionals in therapy for autism. So that's important. And then the other parts of a strengths-based intervention are first to, whenever thinking about an environment where a child is receiving care, whether it's a school setting, a clinic, in the community, even at home, that we're thinking about the fit between that person and their environment, and that we're making every effort to modify the environment in a way that best supports that particular child's learning. So as an example, some autistic children have hypersensitivity to certain types of sound, so that people having conversations in the background, or traffic nearby, or the sounds made by other children in a classroom can be quite noxious. And so it can feel something to us that just sounds like a routine noise might feel to that child like nails on a chalkboard. And so we really need to understand a child's neurodevelopmental profile, their sensory processing, and then modify environments to really create good learning environments for that child. I think a strengths-based approach also. Oh, yeah, go ahead. I think a strengths-based approach also really emphasizes creating trusting relationships and allowing that trust to develop over time. It recognizes progress. It focuses on, it rewards effort, not just outcomes, and focuses on the progress that has been made, not just on the problems that still remain to be addressed.
It seems to me like, are there common themes of those types of, like, as you call them, like accommodations that you see with autistic children, or is everybody so unique that there are no themes? Or is it a combination of both?
There are common themes. Yes, it is a combination of both. There are some common themes, and yet we also need to remember that there are unique features too. So we have to think of every person as an individual. But some of those common themes are hypersensitivity to certain stimuli in the environment. Often it's to certain types of sound. Another theme is there can often be enhanced visual processing. So information that's coming in through the visual system is often more effective, better, more easily processed by the brain, and more easily remembered and recalled at a later time. So what we might think of as photographic memory, that is something that is more common in autism. And at the same time, the processing of auditory information, like spoken language, is a little bit more difficult, requires a little more effort, may take more time. There have even been neuroscience studies showing that the information that comes in through sound and is processed in the auditory pathways in the brain, that those signals take a bit longer, and they take a little bit, they're processed differently compared to neurotypical brains. So one support that's very often helpful is providing information, including language, in a written form rather than purely spoken. I'll say another theme is that very often for regulation, an autistic child would benefit from frequent breaks that involve movement. We find that certain forms of structured movement opportunities, physical activities, physical exercise, can be very regulating, and then help a child then to focus better when they return to a learning activity.
Well, and that makes perfect sense when you said earlier that exercise has been one of these evidence-based interventions that has been so helpful. So that would make sense that to have those physical breaks could help somebody to help them. So I think that's great. Are there certain steps that a therapist could take to help assess the strengths? I'm going back to strengths now. Sorry that I diverted us
Yes.
on these themes, but going back to the strengths, are there certain steps that the therapist can take?
There are many steps that a therapist can take to better understand their client's strengths. A lot can be done just through gathering more information, asking questions of the client or of the people who know them well. So thinking about what are a child's motor strengths, for example. Well, we want to know, what do they do? Do they walk? Do they run? Do they jump? Do they climb? How are they on playground equipment? What sports or recreational activities are they involved with? So what can they do? Um, and for cognitive strengths, for example, we might want to know, um, what does your child remember well? When have you seen them uh, learn something new? What topics are they interested in the classroom or outside of the classroom? Do they engage? Do they love puzzles? Um, Interestingly, sometimes children who are experiencing emotional dysregulation, when provided with some type of cognitive stimulation, like a puzzle to do or a math problem, so depending on their cognitive profile, it might be something unique, but just engaging in that task can then be very emotionally regulating. So I would say there's so much that a therapist can learn simply by gathering this type of information about a child from those who know them well.
When I listen to this, I can't help but think, in a certain sense, that could be everybody too, right? Like I know, if you have high anxiety or something, focusing on a task can kind of bring that down. So in some cases, maybe these are just more extreme, but it can often be common things that other people would use to come kind of self-regulate as well.
Yes, that's such a great point, and I think really worth emphasizing because um, autistic characteristics are human characteristics, and it's really helpful to think about what we all have in common. So there are certain things that we do, like that in autism might be labeled repetitive behaviors, but actually all people do. We may, bounce our leg or twirl our hair or fidget with something because it helps us in some way. And in autism, it just might look slightly differently, but often those kinds of behaviors serve a similar purpose.
So underneath my desk, I'm playing with this little thing because I always have some kind of fidget thing going. So, I'm speaking from myself here. So could you give us some tips of helpful ways that clinicians can talk to families and caregivers about this approach?
Yes. So some of the things that I've found very helpful are to help to talk to caregivers about the different um, the different body systems and how they influence the brain. So that's one way I think to um, help families and caregivers think about their child in a more holistic way. I also will talk to families about how much brain development is influenced by a person's experiences. In neuroscience, that's called experience dependent neuroplasticity. And given the fact that the child's brain is going to be shaped by their experiences, and it's really important to adopt a whole child view where we're thinking about all of the relationships and interactions and experiences the child is having and all the different contexts and environments where they are: school, community, home, uh, clinic. Um, so I find those to be helpful. And then I also like to emphasize that a whole child approach actually is a whole family approach. So we really want to be very much family centered, and that anything that we can do to support the well being and quality of life and mental health of family members will directly help the child in their own development and growth as well.
Earlier you mentioned that a lot of times the caregiver, the family feels like they're having to quarterback all of this stuff. Um, how do they react when you talk to them about it? Are there any sort of tips that therapists should have to manage those expectations?
Um, I think a great place to start is to tell caregivers they don't have to do it all at once. The best place for them to start is with whatever they feel most capable and comfortable carrying through with. And then I think a second is to pause and recognize just how much they're doing. I find that parents, caregivers who are doing a tremendous amount sometimes still feel like a failure. And in my view, their actions have been heroic. And I think it helps to have a professional to pause and just recognize that and remind them of that.
So I love that, Dr. Go, because in a way you're saying kind of the same thing as for the autistic child is to focus on the strengths. It's the same thing for the family and the caregiver is to focus on their strengths and
Absolutely.
acknowledge them. And because I would imagine it is so hard. So to just almost acknowledge how hard that is and how well they're doing must really be able to set a stage to have an open conversation where it doesn't feel like, okay, the way you're doing it is wrong. We're going to now pivot over here instead of these are some tools to just help make it a little bit easier for you and to get, some better outcomes and with the ultimate goal of having joy, which I loved what you had said earlier. So that feels like a really good strength-based approach. From a practitioner who's using the whole child approach, what 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 may be challenging for them, and do you have any recommendations for them to kind of progress?
Yes. I think what's most challenging about this kind of whole child, holistic, integrated approach is that it does require quite a high level of collaboration between professionals. Now, in my experience, healthcare professionals enjoy collaboration. That's how we learn, but we often don't have time for it. So creating that time and space is important, but also I know very challenging. Another is that I think it requires of us a greater degree of openness, a willingness to learn from others, and a willingness to explain what we're doing in terms that others will understand, even if they haven't been trained in the same way that we have been. So there's a bit of translation that needs to happen between healthcare professionals. But I think it's so important that we try our best to make what we're doing understandable and accessible to other professionals and also to caregivers themselves.
No, at Psych Hub, we're obviously big. What we do is so much about education. And so I'm curious, both how does psychoeducation play into this? And then also medication. So you talked about earlier some of the different medications that can be prescribed. How would you say those two areas would factor into this approach?
Yes, well, I'll start with medication. Medication has a very important role. Um, at the same time, often families have differing views on medication. Some are very reluctant, understandably. They're very worried about side effects. Often parents will tell me they feel their child is simply too young. So many of these medications can be used quite safely under the right professional guidance and supervision in children as young as age 2, 3, 4. But caregivers are understandably often worried about starting medications at such a young age. I think that on the medication side, I like to help caregivers from the beginning understand what their options are, but to let them know that they can navigate this journey in a lot of different ways. If they prefer, they can start with developmental and behavioral types of therapies. That's a wonderful place to start. In fact, often the best place to start. But there's times where a children might not be able to engage in those therapies well without a medication on board to help. And so that's an important conversation to have as well. But also knowing that a medication can be stopped at any time. I think sometimes caregivers feel that if a medication is started, they're committed to it, long term, and that's not the case. Um, yes, sometimes when you stop it, you have to be very careful, depending on how long the child's been on it and what dose. You might have to take them off slowly, but starting a medication doesn't mean in any way that you're committed to it long term. You had also asked about psychoeducation. At first, I wanted to find out what I think of it in certain ways, but how do you think about psychoeducation? And then I could speak to that.
Well, thinking about educating to the client themselves, and or family caregivers, like how important is it that they understand sort of what's happening and why it's happening, and that's how I would think about it.
Yeah.
But I also want to
Yes.
hear about how you would think about it.
Well, yes. So we sometimes will refer to it as parent coaching or caregiver education, but that is an essential piece of a whole child approach. In fact, just with that component, educating and supporting caregivers, you can accomplish so much. And so I think it's probably the piece that should be started first. But there are lots of different areas for education. One is understanding the medical or health side. So what's happening in autism biologically? Why is it important to better understand a child's genetics? Or why is it important to do, for example, an electroencephalogram, an EEG? What can that tell us about the child's brain's electrical function? And that has a lot of implications for then how we support a child. So there's a lot of education around those kinds of topics, also around things like sleep. How can we know that sleep disturbance is present in an estimated 80% of autistic individuals. So, and sleep is essential for brain function and brain development. So how can we ensure the child is getting adequate sleep, nutrition? We know that the health of the GI system is very important, that if you've got chronic constipation or diarrhea or reflux, all of which are more common in autism, it's very hard to focus, to learn, and that experience of pain can be truly, can truly get in the way of a child's learning opportunities. So there's that type of education and training involved. And then there's the rest that relates to more development and behavior, helping caregivers understand the things that they can do in everyday settings, especially at home, to support their own child's development. And there's one particularly helpful concept that we use a lot called the Just Right Challenge, where it's the Just Right Challenge refers to a task that is just above a child's current skill level, but with practice and support, they can do the task, and over time they can become independent. And so we very much want to help caregivers start to see opportunities in everyday routines where they can present their own child with the Just Right Challenge, and in that way scaffold and support their child's development.
We talk a lot about measurement-based care and feedback-informed care. How does the therapist know that these techniques are working? And I guess what would success look like for ongoing support?
Yes. So being able to gauge progress, and in healthcare, we often refer to outcomes. It's essential. And for autism, it's a little more complex because child development is so complex. So the approach we use as part of our whole child model is to look at actually many different outcomes. So one set of outcomes relate to physical health and medical metrics. So how well are co-occurring medical conditions being diagnosed and appropriately managed, like seizures, like sleep, like chronic GI conditions, for example. Also, mental health conditions. So the co-occurring mental health conditions with autism, are they being screened for? Are we then, if they're present, are we appropriately offering the range of different treatments? Also, a big, of course, category of meaningful outcomes and indicators of progress in autism are developmental. So, how is a child's language progressing, their sensory and motor skills, their social and emotional skills? And then one additional that's extremely important is child and family quality of life. And so I find that if you've got your eye on all of those pieces, and you're tracking progress in those areas and using standardized assessments when helpful, when appropriate, that can really give you a good sense of whether what you're doing is having a beneficial effect.
It's great. This was super helpful. And I could see from a therapist that you gave us a lot of really great information. I want to pivot a little bit over to families and caregivers. So we said earlier that a large part of this approach is demystifying treatment. So why is demystifying it so important for families and caregivers?
I think caregivers are hearing a lot about autism and often anecdotes. So they'll hear, actually had a family ask me just yesterday about stem cell therapy. I often have families ask me about things like fecal transplants, or is there gene therapy available? There are just a lot of sort of anecdotes and a lot of information swirling around about autism. And I think it's hard for caregivers and for professionals to know what to believe. And it's just a lot of information to take in. And so I think there are some myths around autism. I think, depending on what you're exposed to and what you hear, people have different beliefs about autism. So I think it's just, from my point of view as healthcare professionals, the more transparent, clear, and understandable information we can provide, the more I think caregivers can begin to develop an understanding of autism that truly is helpful and truly is based in the best knowledge we have from the research that's been conducted.
That's great. In your book, you mentioned that it's important for caregivers and children with autism to nurture a happy and healthy family life. What are some steps that caregivers can take to strengthen family bonds and foster a sense of family well being? And I would imagine in some cases it's pretty challenging.
Yes, it's very challenging. The way I like to approach it is to think about a family as having unique individuals first. So, what is each person in the family doing to nourish their own well-being? What are the self-care activities that they're engaged with as individuals? And then I also like to think about the relationships within a family. So each member of the family has their own unique relationship with each other member of the family, and do they have time together? And how is that particular relationship being nurtured or supported? And then, of course, there's the entire family unit altogether. I also feel it's important for a family to identify what really matters to them, and also, what do they feel is their purpose as a family? What are their values? And a lot of that can get lost in the day to day because, especially around autism, there's so much to do. Even simply like the drop offs, the pickups, the scheduling of appointments, modifying the diet sometimes, giving medications or nutritional supplements. There's so much to do. And so I think it's important to pause and also refocus on really what matters to the family, and are they nurturing the relationships within the family that are so important.
I really appreciate that because it sounds like you lead this whole model with a lot of empathy. into all the different things that are happening into someone's lives and that, need to kind of get addressed. How can clinicians support families in taking these steps that you just mentioned?
I think one of the biggest things is to to really lead with caregiver wellness. So we know that caregivers of autistic children are much more likely to experience anxiety and depression themselves. They often experience sleep disturbance, sleep deprivation. So just delivering the message that anything the caregiver does for themselves will help their child is important, because I find that parents will put their own needs on the back burner for years sometimes, thinking that all of their attention needs to be on their child. And one of the phrases I use in the book Magnificent Minds is let's spread the spotlight. So sometimes the spotlight is so shining so brightly on the child and all the things that are being done for the child. And instead, let's spread it to other members of the family and to the caregivers themselves, to take care of themselves.
Yeah, I could totally see that that would be important. Can you give us any other examples besides like share or spread the spotlight on how things that people could do to positively impact these families?
I think that there are two things that I hear a lot from parents. One is that they're seeking respite, that they need help. And sometimes respite is available through, for example, there are some programs, community programs or even government agencies that can provide respite services. I say take advantage of those. And then lean into friends and family. Those can be important sources as well. The other thing I hear so much from caregivers and I see make a really meaningful difference is community and connection. So things that we can do to help caregivers form relationships with other caregivers who might have gone through some of the similar experiences is really helpful too.
Which, of course, again, makes sense for all kinds of things that people are struggling with. Something about commiserating, right? Knowing you're not alone and other people have those same experiences can go such a long way. So I want to
Yes.
now just look at so congratulations on this amazing work that you've done. It's incredible. And I can't even imagine how many lives you've impacted by this approach and that Cortica now does. When we look out on the horizon, are there any limitations to the approach? Is there additional research that needs to be done?
Yes, there's so much additional research that needs to be done, because um, we really are at a place now where there's tremendous potential. So much has happened, and we've come so far in our understanding of autism, biologically, physiologically, but also all of the factors related to a child's experiences, and the social world that make a difference. So we know so much more now, and really the role I think of research going forward is to then continue to support innovation, to look at really novel therapeutics, whether it's in the form of pharmacological interventions, so novel medications, for example, that target not just aspects of the nervous system, but even things like GI health. And so Cortica is currently part of conducting some research looking at a novel medication that improves gut health that looks very promising for autism. It has been studied in mouse models, shown to improve the core features of autism, is now being studied in children. So I think research in all of these exciting new directions is very important. I also think research looking at not in just individual therapies, but looking at combining these therapies and what the outcomes that may be possible when things are done in combination rather than just in isolated ways is also very important.
Wow. People are going to just gain so much information from this. And I think that we're going to have some listeners who are going to want more. So, do you have any tips for therapists on how they can continue their education and training on the evidence-based care for children with autism?
Well, we're fortunate now. Just a few decades ago, there just wasn't enough information about autism. Now there is so much. Sometimes people might feel like there's too much. But the good part of it is that there are a lot of opportunities for continuing education focused on autism and related conditions. I would encourage professionals to actually look even outside of their own individual field of training and to not be afraid to explore continuing education opportunities that are offered by other disciplines, other specialists. I think that's one of the most effective ways to expand, to extend the boundaries of our own competence and our own expertise.
Yeah, that's a great way to look at it because I think so many times we do look at our own discipline. So, to wrap up, we got a lot out of this. We discussed what autism is, the characteristics and commonly co-occurring features. We discussed the whole child approach and how it helps to support children with autism and their families more effectively, and how therapists can use a strength-based framework to better support autistic children and their families. So my last question is, what is the number one thing therapists should take away from this discussion?
I think the understanding that a diagnosis of autism is just a starting point. It's not the answer, it's not the end point, it's the starting point from which a lot of additional understanding, investigation, and then support can be offered from so many different avenues. I think that's what I hope that professionals will get from this, and that I hope it will shape the way they think about autism and support their clients.
That is great. So where can our listeners find out more information about your research, the whole child approach model of care, and your upcoming book, which I can't wait to get, Magnificent Minds, the new whole child approach to autism, which comes out April 9th?
Oh, there's a wealth of information on our website, so corticacare.com. And the book, Magnificent Minds, I think brings all of this information together really nicely. And my own individual website, drsuzannegoh.com.
And I see on here also you have an Instagram, so I am going to follow you. It's Dr. Suzanne Goh. Mine is Marjorie M. So maybe we're going to follow each other now so I can follow up on all of this great stuff that you're doing. Thank you so, so much for taking the time to be with us today and share your incredible expertise and all of your unbelievable knowledge with us.
Thank you for having me.
Thanks so much for listening to Therapy Cafe, the future of mental health. For more information and resources regarding today's topic, please take a look at the episode show notes. If you'd like to obtain continuing education as a psychologist, counselor, social worker, or therapist, you can purchase a 1-year subscription to PsycHub's learning platform. Once you're signed up, you'll have access to earn CEs for this and every Therapy Cafe episode. Plus, you'll have access to our existing library of over 100 evidence-based practice continuing education courses created by expert clinicians. Go to psychhub.com/sign up for more information.